Hello, everybody. I'm Aaron Souza. I'm the interim dean at the College of Human Medicine. I want to welcome you to our fourth in a series of webinars, really highlighting how some of our MSU faculty in this time of COVID are doing work either related directly to COVID or how we're coping with COVID. So we are planning to do additional events in the future. I hope you look for details about this on your email. If you have ideas, please let us know. And today I'm delighted that we have Cara Poland with us today. She's an internist and an addiction specialist. She's an assistant professor at Michigan State University in our College of Human Medicine. She was trained in internal medicine at St. Joseph Mercy Hospital in Ann Arbor and in addiction medicine at Boston Medical Center in Boston, of all places. Cara has an interest in educating healthcare providers and providers in training to improve for patients with substance use disorders and alcohol use disorders. She's past president of the Michigan Society of Addiction Medicine. Additionally, she's the medical director of addiction medicine at Spectrum Health and collaborates with other providers at Spectrum Health's Great Moms program to treat pregnant women and substance use disorders. She is having her own COVID-19 home experience with two children, her husband, two hens, a dog, or a rooster. The rooster's name is Jim and is noisy from sunup to sundown. So it is dark now, so I'm presuming that Jim will not be bothering us today. It is, I have long enjoyed working with Cara and really think the world of her work, and I'm delighted that she's willing to spend some time with us today. We are going to have time for questions at the end, so by all means, think about those, and we can either have you raise your hand or put them in the Q&A, and Nikki and Mark can help keep us honest about that. So without further ado, Cara, the screen is yours.
Awesome. Thank you so much. I am going to go ahead and present my slides. It looks like there's a relatively small group here this evening. So certainly if people have comments or wish to interrupt me, I'll try to keep an eye on the Q&A as well. I believe that everybody is muted, so I'll try to keep an eye on that. Thank you so much for the introduction. This is sort of what we're going to be covering this evening, and hopefully everybody learns a little bit and has a little bit of fun doing it. These are the objectives for the evening. We'll talk about risky substance use and how that might differ from a substance use disorder, how isolation and COVID-19 in particular together have impacted substance use, starting with a framework of how isolation affects substance use alone, and then better ways, some tools and tricks that we use to help coping with holiday stress. It's something that we talk about a lot in addiction. I don't think we talk about it as much as I often say to my patients. It's simultaneously the most wonderful time of the year and the most stressful time of the year. So we'll talk a little bit about ways to maybe address some of that stress. I'm going to start by just doing a general overview of addiction. Our disease model of addiction has changed over time and over the years. And I think it's really important to remind us all that addiction is a treatable chronic medical illness, not unlike something like diabetes or high blood pressure, that can kind of be under good control. And then we can have periods of time where it's a little bit harder, where things are a little bit more difficult to manage. I don't know if anybody's ever gone on a diet that's in the audience today, but I know I have. I certainly have failed at every diet I've ever tried, because those permanent lifestyle changes that they tell us are the healthy way to do things and that's how to be successful are never as easy as they say. And that holds true for things like high blood pressure and going on what they call a DASH diet, a low salt diet, a low sodium intake diet, to something like addiction, where we are asking people to change kind of the fabric of their lifestyle and what they do on a day-to-day basis. In addiction, we talk about characteristic signs and symptoms, and we talk about this with most things in medicine. We call it the ABCs of addiction, and you can see that we have signs and symptoms, ways and tools and measurement modalities for diagnosing the disease. when we talk about recurrence rates or return of disease, we see that it is comparable between drug addiction and other chronic illnesses. This yellow bar is addiction recurrence rates are 30 to 50% of people. When we look at diabetes, it is 40 to 60%, and these two at 50 to 70% are hypertension and asthma. Are well controlled. So while we see that addiction is slightly harder to control, we see that it is certainly comparable to many other illnesses that we treat and on a regular basis in healthcare, and that we all know people that have in our lives and in our communities and in our friend groups and maybe even our families. And addiction is no different than that. Addiction has some very specific areas of the brain that it affects. And one of the areas is something called the ventral tegmental area. It's this purple box, it's this purple circle right here. I like to call that the gas tank. This area of the brain supplies the chemical called dopamine, which motivates us to do something again to the other areas of the brain. And the other areas of the brain to supply endorphins. And endorphins are actually the chemical that makes us feel good. A lot of people think that it's dopamine. Dopamine's our happy chemical, or serotonin is our happy chemical. It's actually opioids that cause us to be happy. And we all have naturally occurring opioids in our brains. My children who are 6 and 8, they have opioids in their brains. Opioids themselves aren't bad. It's when we get opioids from outside and we have the right set of factors in our lives to cause us to really crave that feeling, or to feel that feeling that we feel different when we use an opioid or another substance like alcohol or marijuana. The nucleus accumbens supplies that dopamine to the ventral tegmental area supplies that dopamine to the nucleus accumbens, which I call our go center. The nucleus accumbens is our pleasure center. It's what makes it feel good. It responds to things like dopamine. It responds to drugs like opioids, like alcohol, like benzodiazepines, things like Xanaxes, things like Vicodin, things like marijuana. It responds to food. So this is why, if you're eating dinner and you think about having dessert and you say, really, I shouldn't have dessert. I'm pretty full. I don't really want it. But the kids come with a bag of Oreos. You're more likely to have a bag of an Oreo after saying you're too full than say a carrot, because that carrot doesn't release that simple sugar fast. And what we know is that things that go into the brain quickly and out of the brain quickly are more rewarding. They make us want them more, which is why something with a simple sugar that's really easy for your body to break down and get into the brain faster and cause a better spike in our sugar rates make us want to do it more. It all has to do with this area of the brain. It has nothing to do with anything else. And so sex is along those lines. That's why an orgasm doesn't last for 5 minutes. It lasts for, a couple minutes maybe. And this area of the brain sends reinforcing signals to kind of the thinking part of the brain, the cortex, in particular, the front of the brain. We're just going to do a little animation to kind of hopefully show what I'm trying to get across. So here's a carrot. Doesn't that look really good? If you haven't had dinner, you're probably starting to think, maybe I should have carrots for dinner. I'm going to skip the Jets pizza tonight and just have a bag of carrots, right? No, that's not what happens. Anybody feel different when they see this image? I mean, even myself, I've shown this image. I know what's coming. I created this talk, yet I am noticing that I have a little bit more saliva in my mouth once I have the picture of the ice cream sundae up there. And why is that? That's something called our affect. It's our unconscious response to seeing that stimuli and preparing for our body to actually start digesting the picture of the ice cream sundae, which we all are aware in our thinking part of the brain, in our cortex, that that's a picture, but we can't control all of those unconscious stimuli. Now, over time, as I realize that ice cream sundae isn't coming, and as I take in that picture away, you'll notice that you stop producing as much saliva, because now your brain is no longer getting that unconscious stimuli. So that frontal cortex is the part of our brain that helps us make, it's the CEO of our brain. It helps us make good decisions versus not so good decisions. It's not fully developed until we're in our late 20s. I often tell people, you know what? You are talking right now to the frontal cortex of my 6 and 8-year-old because their cortices are not fully developed, this kind of thinking part of the brain. And it's great in some ways because I can get more control. I can get more buy-in. I can just, when I state a fact, it's a fact, whether it's, bedtime is a fact. It's not an opinion. It's something that we just know is what is the expectation in our house. No, you try telling a 16-year-old that bedtime is 9 p.m., they're going to look at you like, who are you joking? Right? And they're starting to develop that autonomy. Their frontal cortex is starting to kind of want to take some control and say, I'm going to negotiate that a little bit. I don't want to go to bed at 9 o'clock. I want to stay up a little bit later. I'll be okay the next day. I can still get up and get ready for school and, sit in front of my computer, I guess now, versus going into school, whatever the case might be. Now, when we look in substance use in particular, the average age of the first use of a drug of misuse is 12 years old. Now, when I think about myself at 12 years old, I can tell you I was a lot closer to playing with Barbie dolls than I was to being a physician. And so I was certainly much closer to not having that frontal cortex and not having that control. And I definitely wasn't thinking when I was 12 years old about what the consequences of my actions at age 12 were going to be 10, 20, 30, 40 years ahead. My brain didn't have that capacity. I didn't have the capability of doing that. And that's something that we often miss when we're talking to patients and when we're talking about things like lifestyle changes, when we're talking about diet, exercise, all those things that we know are healthy for us, but are just hard to do because we have these competing areas of our brain that are conditioned at a very young age to maybe not do the things that we know are the best for us, or why it's so easy, once you eat that piece of cheesecake or have that ice cream sundae or do that or don't exercise for 3 days in a row, why it's harder to get back into that is because we're fighting against these kind of middle and brain areas that are not part of our conscious control. We're trying to fight them with this big cortex with our thinking brain, but those messages that are coming forward from this unconscious part of the brain are just very, very difficult to overcome. So what happens in addiction is you'll often hear people say that addiction has hijacked the brain. You'll see this in writings. You'll see this in treatment websites for treatment programs and things like that. It's really common for people to say that addiction has hijacked the brain. And what they mean is that those middle brain areas, those earlier areas, those unconscious areas of our brain have just overtaken the thinking process that occurs in the brain. So why do some people become addicted? There isn't one factor that I can point to and say, person A is going to get addicted and person B isn't. It's a combination of our biology, the genes that we have, the environment that we grew up in, the development that we had when we were, when we were being formed in mom's uterus. It's a combination of all those things that come together. Certainly, if somebody never smokes marijuana, they're not going to develop a marijuana use disorder. We all know that. So that's where the environment can play a role. I apologize for that. I hit my scroll button on my mouse. So when we look at alcohol use in general, we see that 40% of all people are defined as abstainers. They just don't drink. They don't drink on holidays. They don't drink on weekends. They just don't drink. 35% of people are low risk drinkers, which is really defined as people who are within what they consider healthy drinking limits, which are no more than 7 drinks in a week for women or 4 drinks in a sitting, no more than 14 drinks in a week for men, or 5 servings of alcohol in a sitting for men. And a sitting is defined as a 2-hour window. Now, how many of you can tell me what a serving of alcohol looks like. How many ounces is a serving of wine? How many ounces is a serving of hard liquor? Does it matter what proof the hard liquor is? These are the kinds of details that we don't often know, and what we've seen as vessels have gotten bigger, as we can now get the big gulp and the super big gulp, and the large drink from McDonald's is the same price as the small drink. Who gets the small drink anymore, right? As all of these things have changed in our society, we've also seen alcohol consumption and alcohol quantities rise. They now have 20-ounce beers instead of 12-ounce beers are becoming more common. So we have to be very aware of what those quantities are. And then high risk drinkers are people who are drinking above those healthy amounts, but aren't having any sort of signs of the brain disease of addiction. They might have at-risk drinking, but they aren't having disorders as a result of that. And then at the top of that pyramid, with about 5% of the population, is probable alcohol dependence or an alcohol use disorder. I'm gonna go ahead and skip the next couple slides. So we do see a difference as people age, and as so we see 1 in 6 young adults in the 18 to 25 age range battled a substance use disorder in 2016. This is the highest percentage age group. We attribute some of this to that risk-taking behavior we see in teens and young adults. We also attribute this to culturally, it's acceptable for this age group to be drinking more, and it's in some ways encouraged in our society as well. Many people, as they hit those milestones of graduating from college, having children, getting married, will naturally kind of reduce that consumption and get back down into healthier limits. When we look at the rates in men versus women, men tend to have more substance use than women, but women are just as prone to addiction as men. Rates of substance use disorders among ethnic groups are moderately variable, but certainly not enough variable for us to not encourage screening across the health spectrum. So if you're ever asked by your doctor about alcohol use or other drug use, know that that's actually best practices. They're not saying that you look like you drink or you look like you have a problem with alcohol. They're just, they should be asking everyone about their drug and alcohol use in order to make sure that we can provide the best care possible to a wide variety of people. Children are definitely affected by the opioid epidemic, and you'll see that if we don't make changes to how we're treating the opioid epidemic, here's our current state, what that might look like if we don't put forward more efforts towards healthier families, including children. So let's talk about addiction in our communities. So I'm going to go through a series of very famous in the addiction world studies. They're called the Rat Park studies. If you're interested in reading more about it, if you do a Google search of Rat Park cartoon, there's a little cartoon strip that goes through all of the different studies that were done on this, that were done by this lab. So this is a gentleman named Bruce Alexander, started in the 80s. He's out of Vancouver in British Columbia, Canada. So a shout out to my fellow Canadian citizens. So in the 1980s, he did some experiments where he put rats alone in a cage, and he gave them the option between 2 water bottles. One had plain water and one initially had cocaine. He's also replicated these studies using other substances of misuse, including opioids. And the rats used the drug water until they overdosed and died. So it was thought then that exposure to drug would lead you to use it until you overdose and die. And that's really where the Nancy Reagan, war on drugs, DARE for my fellow 80s babies kind of came to be. So Bruce Alexander in his lab said, there might be something to that. We put these rats in isolation, and part of the reason we use rats as a human model is because humans are social creatures and rats are social creatures. So what effect does stripping them of their socialization abilities have on their substance use? So he created Rat Park, which was kind of a rat paradise. It had toys, foods, tunnels, friends, family members. you could have some fun in Rat Park. And he did some comparisons. He looked at the rats alone. They drank the drugged water. Rats in the park tried the drugged water, but the vast majority didn't continue to use it. They went to the plain water. There were some rats, but it was a vast minority that used the drugged water. Meanwhile, we almost had a natural experiment in the Vietnam War. So 20% of soldiers used heroin while on duty. When these soldiers were coming back, we were very concerned about the potential for substance use disorders in these soldiers. And we had lots of policies and procedures in our VA and in reintegrating these soldiers as they returned to the United States. But 95% of the addicted soldiers discontinued use after returning home. So they went from an environment, a war zone, where literally they didn't know what the next moment was going to bring, when they might be ambushed. It wasn't a war that was well supported back home. There was a lot of misunderstanding about what their roles may have been for many of them. And so when they came back and they were reintegrated into society, and they were able to be with their family, their friends, their loved ones, they redeveloped kind of their Rat Park or their community, which is all Rat Park was a community for the rats. So what Dr. Alexander did next was he took rats and put them isolated in a cage for 57 days, which was kind of determined to be the amount of time that you needed to get the rats addicted. And he then reintegrated them back into Rat Park. They went through withdrawal, but they reduced their use and avoided morphine for the most part. So in general, consumption decreased, though there were still some individual rats that continued to use the morphine water. But it was much less than the rats in isolation. And there were rats that decided to just use the plain water and not the water that had morphine in it. So what's the human translation of this? So why does that matter to us? People who are prescribed short courses of well-monitored opioids for known acute injuries that happened quickly, and we know where the site of the problem is, and it is recently happened. And when people are prescribed short-term opioids for that, they're very unlikely to become addicted. It's when those prescriptions happen long-term. So there's a study that came out that showed that 6% of all surgeries, doesn't matter how bad the surgery is, on average, or what the surgery is, on average, 6% of people who have a surgery end up having, continuing to have an opioid prescription greater than 90 days after their procedure. And so what we know is that is a risk factor the longer the opioids are on board for having problems with those opioids as time goes on. So what are the social risk factors and the social markers that increase risk? Well, for addiction, the biggest social marker that increases risk is, I'm sure you guessed it, isolation. So as we look at COVID-19 and as we look at what we're telling people to do, as we look at how that might be impacting people, we are certainly seeing that despite this connectedness that we have, despite the fact that we can have talks over Zoom, that we can that we can make appointments and visually see loved ones who are maybe across the nation or even across the world, that lack of three-dimensionality, that lack of presence, that lack of physical touch does have an impact on us. So are we, as we try to isolate ourselves for the health and safety against COVID-19, perhaps also suffering from a human interaction deficit and need more interaction with each other on a very human level? Humans do have this need to bond and form connections. We are kind of a pack animal. We are like the wolves. We are like other animals in that sense. We don't all thrive in isolation. Even people who are very introverted still do benefit from some amount of connectedness and interaction with others. And you'll even hear people who maybe are more on the introverted side make comments like, at first this is great, but it's starting to wear on me. And we expect that from our extroverted colleagues and our extroverted friends, but seeing that in our introverted friends and colleagues is another level of wanting to make sure that we are addressing our connection with each other. So what Dr. Alexander is very famous for saying is that the opposite of addiction is actually social connectedness. So one of my favorite quotes for him is, "For too long, we have talked exclusively about individual recovery from addiction. We need to now talk about social recovery and how we all recover together." So I want to talk a little bit specifically about holiday stress, and then we should have about 15 or so minutes for talking for questions and answers. So Americans, so in a NIDA funded study, about 29% of Americans drink more during the holidays. It's unclear if this is driven by celebratory drinking or holiday stressors. With more than 84% of people feeling moderate to overwhelming stress during the holidays, appears to be maybe a component of not so happy holiday drinking included in this. The major causes of stress, according to this study, were general finances, gift giving, and family relationships. I don't know about anybody else, but I do know that the single person in the world who can best push my buttons is my older brother. He's been honing this skill from like literally the day I was born. I mean, don't get me wrong, I love him dearly, but he still knows exactly how to make me tick and make me explode. Now that we have children, we've kind of matured, we can at least come around together around lamenting the difficulty of making our holiday wishes come true for our children, and talking about what that was like when we were kids, when you wake up and you see the bountiful pleasure that Santa Claus has brought into the world, or when you sit there and you light the menorah with your family, or you celebrate your other holiday traditions. You know, let's not even like consider this year, you know, work, friend, holiday parties. And I know that they're kind of out of the picture this year, but those relationships still exist. And there are still pressures to be cheerful during the holidays. And those can present their own kind of stress on different people. We know that over 50% of American households go into debt in the month of December, looking to make it the best holiday ever for their children. So we do see that that people increase their alcohol use during this time of the year, and perhaps as to cope with some of these stressors. We can also assume from that data that people likely also increase other drug use, and intoxication contributes to injury spikes during the holidays. And we see that in some of our emergency room in our emergency systems reporting data as well. So when it's not surprising that these increases also result in these additional emergency room visits. The day before Thanksgiving has historically become the largest bar drinking day. It actually exceeds St. Patrick's Day for the last 3 years. And that is because many people who come home for the holidays to kind of their childhood home will then go out with childhood friends over that night before Thanksgiving. It's become more and more popular to do that. So we do see that Thanksgiving, Christmas, and New Year's account for nearly 40% of holiday-related drug and alcohol emergency room visits. Holidays can be stressful. According to the CDC, the Centers for Disease Control, the most dangerous times of the year for drug and alcohol-related deaths are December, January, and March. The majority of Americans are either overwhelmingly or moderately stressed during the holidays. Well, the holidays, as I mentioned earlier, I tell people all the time, they're supposed to be the most wonderful time of the year, but they can also be much darker and more difficult. It can be a time of family conflict, financial strain, loneliness, grief, and things like seasonal affective disorder come into play and become stronger. We tend to get outside less. We have fewer hours of sunlight. We're not getting as much sunlight. We're seeing more artificial light in our lives and in our world. All of these things kind of come together to make this kind of November, December, and January timeframe much, much more difficult for many, many people. So what do we do about this? Some of these things are probably going to sound a little silly or maybe a little bit overdone, but get enough rest. Don't stay up too late. Go to bed on time. Wake up on a schedule. We call that sleep hygiene. Try to give yourself permission to get enough rest, to say no if you just can't do another Zoom meeting after being on, being on your computer screen all day. It's okay to say that's not going to work for me this weekend, to family, to friends, to people who really should have your best interests at heart. Be selective about what invitations you accept. If something is not going to bring you joy, if something's not going to fill your cup, fill your bucket, for anybody who has younger children, there's a new kids book around filling your bucket. So be selective about what you do accept, and have some backup plans ready. Have something to do other than engage in less healthy behaviors. Have some healthy, make sure there's some healthy snacks in the refrigerator so you're not constantly grabbing for those Christmas cookies. Or if you're in my house, we've got two different kinds of Chex Mix right now because my sister-in-law usually makes Chex Mix for the kids, and they were like, but mommy, we're not going to have Chex Mix. So of course, mommy felt guilty and made Chex Mix. Spend your energy with people who support you. And we've spent the last 3 quarters of the year telling people to isolate, telling people to stay apart. If you are going to get together with your family over the holidays, do it as safely as you can. The CDC is now recommending that even inside of our homes, that if you're meeting with people that you don't live with, so if you're meeting with extended family of any sort, that you do wear that mask. It's safer, it's healthier. Maybe we're gonna have to change some of those traditions, not get together around a meal. Maybe we can get together around a board game or around a movie or around something else, beyond kind of our traditional comforting foods, that we get around the holidays. And I know that's hard, and I know it's a lot to ask, but think about how you might be able to create a safer environment for yourself. Keep busy with healthier activities. I've really, we just adopted a new puppy into our family, a little over a month ago. He's now like 17 weeks old, I think. So maybe it's been closer to 2 months now. Anyway, I've been getting, puppy needs to go for a walk. It's a really good excuse for me to make sure I get out every morning, put on my winter coat, put on my, reflective gear, and get outside and take puppy for a walk. And it's forcing me to have that healthier habit. And that's a great thing. So think about ways that you can maybe work that into your daily life. Yes, I'm getting up a half an hour early. No, I am not a morning person. It's hard, but it's helping me kind of gain that perspective, get some fresh air, get out of my house, get out of these four walls. We were talking before we came in here that some of us are just spending like all our time in practically one room, and how that can kind of make you feel emotionally. Um, and take time to yourself. I know I live in a house with two young children, a husband. You heard we've got a rooster, two hens, and a dog. Time for myself, what is that? But making sure that you do try to take a little bit of time to recharge. As we tell our medical students, our student physicians, what is the one thing in your life that without it, your life becomes harder? And that's the thing that you need to maintain while you're in a stressful situation, while you're in medical school, while you're in intense when you're in these intense, unpredictable environments. So what is your one thing? What is your one thing that you need to keep yourself safe and to keep yourself healthy? And all of my talks to those who have lost their lives to addiction and those that prevent further losses. And I want to thank you all for spending part of your evening with us. And my email address is on there if I can help in any ways. I will open it up to questions. There is one that just came in for Dr. Sousa. Can you? Oh, I think it is just a personal comment.
Oh, look at that. Well, that's
somebody from Dean Sousa's past saying hello.
That's right. And we continue to. We don't have pets on account of my allergies, but we have adopted the neighborhood squirrels and named them, and I've been able to watch them outside. One of the things that has made being holed up in my little office more pleasant is that I have gotten to know a red squirrel, and I do not recommend them as friends, But the gray squirrels, fox and fox squirrels are lovely creatures, and I've gotten to know them as well. So that is one of the silver linings. And for those of us who have kids of college age, I've had an extra 5 months with my son that I didn't expect to have, um, which has been great. And it's true, on Evergreen and over here on Sunset, we have too many squirrels, and I may be in part the cause of that. So Cara, I have a question. It's more of an addiction question, and so the state has more or less legalized marijuana. What have you seen, and what have your fellow addiction specialists seen since the legalization of marijuana?
So we're seeing, so my commentary on marijuana is not going to be surprising. It's concerning to me. It's concerning to me because we've, in some ways, medicalized marijuana. However, all medications that we prescribe as prescribers, as physicians, nurse practitioners, and PAs go through a vetted process through the FDA, right? And we are required, and they go through a rigorous study period. And when we rate a prescription, we rate a dose, an amount, a frequency. And when somebody goes to a dispensary, we don't really know what they're getting. Even when people are getting CBD oil or THC oils that have concentrations on them, that's not vetted by the FDA in the same way. So we actually know that about 80% of those products don't have what they say they have in them. And so that, and in addition to that, 80% of products that say they are CBD based actually also contain THC, which is the psychoactive component. So that's concerning because people just aren't getting what they think they're getting. Or are getting different things than they think they're getting. And that's not what we want for anybody. We are also seeing, and one of my colleagues here in Grand Rapids has been doing some really important research that's getting some national attention. She's actually a pediatric hospitals fellow, Alex Sheely, and she's been doing accidental marijuana exposure research in the pediatric population. And we've actually seen that double year on year for the last 4 years. And if we look back into the campaigns to get legalization for marijuana, that's about when they started. We see a steady amount of pediatric exposure. Then when we start seeing that campaigning and then the legalization, we see it double year after year. And that just makes me nervous because we know, well, marijuana isn't a gateway drug, and that, like, if somebody uses marijuana at age 13, they're going to be using cocaine at 16 and heroin at 18. That use of marijuana in a younger age group is a marker for a risk-taking behavior. A child who uses marijuana at age 13 is displaying a risk-taking behavior that a child who doesn't use marijuana at 13 is not displaying. And if they have a good experience with that marijuana, they're more likely to then take additional risks in the future. And that's what makes me nervous.
Thank you. I mean, I certainly decriminalization of marijuana is a whole nother social issue, right? In part because there were, I think, fairly well demonstrated racial differences in how people were sentenced and what happened to people, and how the criminal justice system addressed that had its own set of problems. And personally, as an internist, I was not real thrilled with the medicalization of marijuana for the very reasons that you said. They often use slightly different scientific methods and expectations when the state was determining whether or not this was something you could use it for, and it's just not regulated in the way medications tend to be. And so anyway, thank you very much for your take on that. And we have a couple of other questions, and I think you can raise your hand as well, but if not, Um, let's see here. So there's an anonymous question. Cara, this is not about addiction, but you talked in the very beginning about how difficult can be to get up and work out, walk, etc. Why isn't it our natural tendency to do what is healthy for us? Why are we defaulted to laziness and have to motivate ourselves or discipline ourselves to do the right healthy thing?
Because not everything in life that is good for us is things that we want to do. When we look at foods in particular, we see just like with substances of misuse, things that go into the brain quickly and out of the brain are more reinforcing. From an evolutionary standpoint, having that simple sugar, eating those berries, which are very sweet, to be able to get going and get moving was really, really important. And in knowing what those food sources were that were rich in sugars was beneficial for us to be able to get foods that were going to fuel us and energize us so that we could function. When we think about exercise and we think about some of those types of things, we used to be much more active, even if we look as little as 50 or 75 years ago. And our society has become more sedentary, right? We're all sitting in front of computers right now. Some of that was happening less. So there was actually a benefit to slowing down and stopping in order to conserve energy so that when you needed to move, you had the ability to do so. So now that our world has functionally shifted, so food isn't a scarce resource, so the ability to rest isn't a scarce resource, our brains just really haven't caught up. It's not fair.
Well, I mean, in some ways, it's a marker of success because, as you say, right, the real struggle for pretty much all of humanity's existence until the last few hundred years, just about everybody was worried about calories and getting enough calories and being able to get a hold of sugars and sweet things. There's a reason that lots of animals, including us, have a sweet tooth. And that is there's just a lot of energy to be had from those calories. And every spring, people were short of calories. And so we would, as winter would go by and we would run out of food, our metabolism would decrease, and which is what happens on a diet, right? You try to eat
Mhm.
less, your metabolism drops as your body, tries to conserve because that's what it believes it's supposed to do. And then late spring would come and the first food would become available. And your body, rather than just saying, go ahead and eat, actually takes those calories and preferentially turns them into fat, which is why when people are on cereal diets, they actually overall lose weight or gain weight because their body is desperately trying, thinking there's a famine and there's going to be another famine. Your body is desperately trying to save up those calories, and that's just not the life we live anymore. My mother-in-law, who grew up on a farm in Poland before and during the Second World War, when she came to the US and saw people jogging, thought that was the craziest thing she'd ever heard. The notion that people would actually go out to get exercise was absurd to her because people were working as hard as they could to try to keep things going. And really, the only creatures that seek exercise in the way that we're talking about are children and young animals who are training themselves physically to live in the world, whether they're, bear cubs or puppies or little kids. They're running around because they're trying to get better at their physical existence in the world. For them, it's play and fun. And as we get older, that becomes less and less the case.
But I think that was true before, right? It became more about making sure you could provide food
Yep.
for your family, that you could save up those lean foods that would not perish in the winter and things like that. It all plays into some of that.
That's right. So there is another question from Courtney. How has the pandemic affected opioid treatment and opioid use disorder treatment and its efficacy? Have you seen anything different now that you told me before you're essentially all telehealth, and do you guys have a sense of how well this is working or working differently?
Well, it's certainly different. We had some regulatory rules from a federal standpoint that were lightened during the pandemic that have made it easier to get people into treatment in many regards. But as with much of medicine, we've shifted in many ways to doing these virtual visits and really connecting. You know, as I mentioned, connecting outside of that three-dimensional spaces
Mhm.
is somewhat harder. It's also hard to know about patient privacy, I think, for all of us. I don't know that that's specific to addiction. You can't tell if there's someone standing just off the side of the camera or sitting down next to me on the floor, in controlling what I reveal or don't reveal. So we all kind of have those pieces to the puzzle that we haven't been able to really determine. I think that the most important thing, and I think this transcends addiction alone, is really establishing that human connectedness with the patient. If your patient trusts you, if your patient thinks that you are trustworthy, if your patient thinks that you're knowledgeable, if they feel heard, they're going to have better outcomes. And it's not different in addiction treatment. If we, looking on a more local level, looking at the state of Michigan, we know that our opioid overdose rates and our overdose death rates have increased since over what was predicted for this year, and they're actually higher than they've been even when we compare to the worst year so far, which was 2017. And so we have seen that overdose death rate increase. We also know that alcohol consumption, depending on the month, is anywhere from about 35 to 50% higher month on month. So comparing March of 2019 to 2020, April of 2019 to 2020, and so on, we are seeing that alcohol consumption is up, and that does take into account all alcohol consumption, including that done in bars and restaurants.
Right. I think we are up to date on the questions that people have provided. So I want to encourage people um, to leave some. And in a town hall, somebody had left a question for us that I thought I would ask you. What are you optimistic about as we go through the pandemic, and what are you optimistic about?
You know, some of this isolation has been really hard, but one of the things that's been really beautiful is watching my 6 and 8-year-old interact. They've been on virtual school since the very beginning. They have three cousins that one set of cousins they've seen twice, and the other cousin they've seen maybe a half a dozen times. But they've really become each other's playfellows, and um, I hope that sticks with them, that this early experience of kind of being stuck with each other and having to figure it out, and has deepened their relationship in a way that I'm not sure would have happened outside of the pandemic. And that's something that I think is really beautiful. And I hope that they carry that with them, because they might not remember the details of the pandemic, but I hope as a parent, I've created an environment for them where they feel safe, loved, and have those and will have that connectedness. So when my daughter's, 15 and my son's 17, I might spy her sitting in her big brother's room lamenting the woes of the world.
Mm, That's lovely. So Melissa has left us a question. Can you talk about alcoholism as it relates to depression?
That's a really great question. So, alcohol itself is a depressant. So, even though we can kind of find that it relaxes us and maybe makes social situations less stressful, it actually decreases our brain activity and decreases our responsiveness. That's why we're more likely to get into car accidents, and have difficulty. It affects our balance. So, we kind of have a little bit of a different perception at lower doses of the world that kind of can make things feel a little bit more relaxed and comfortable. But long term, when we take something that depresses us over the course of time, it resets our set point at a lower point. And then when we don't have that substance, when we don't have that depressant, it actually can really cause people's anxiety to also skyrocket. So we see that we often see in people who have been using alcohol for long term, this combination of depression with anxiety that can be very debilitating. Often alcohol use people naturally gravitate to it who want that kind of relaxation from it.
Yeah, one of the things, the students are right now working on some of the more psychologically or psychiatrically active pieces. And in fact, many of the diagnoses depend on people not being on substances because either the disease or the condition can be so tightly related to substance use that you can't tell whether it's the substance use or the underlying condition or the other diagnosis.
Yeah, we used to, 5 or 7 years ago, even say that if somebody had a substance use disorder, that had to be totally treated and in a state of remission before we could diagnose or treat other general psychiatric concerns like anxiety and depression or bipolar disease. We now tend to treat them in tandem. But we also still want to be aware that they can exacerbate each other and that they really do connect with each other. I believe we have a hand raised. Can I allow to talk? I know, I was really excited.
I don't know. I don't know if we can pull that off, but I see Melissa there. So let's see what kind
Wait,
of power I have.
I clicked allowed to talk. I wonder.
Hi, can you hear
Hi,
me?
Melissa.
Did it?
So this is so very interesting to me. So thank you for putting this on. And it was kind of a follow-up question to the one. So you talk about long-term effects. So kind of particularly alcoholism, but what about short-term? What about people that don't necessarily drink often or every day or like aren't alcohol?
Mhm.
Like, does it have a direct effect short-term also?
So short term, it can sometimes make us feel more relaxed. We know that even after just having one beverage that has one serving of alcohol, we actually do see that people have changes to their sleep quality. They don't get into the deep stages of sleep. They might fall asleep faster, which is why alcohol's got a reputation of if you can't sleep, have a drink and you'll be able to sleep. It actually makes you sleep worse that night than it would have if you didn't drink at all. And that's true no matter what your dose of alcohol has been. So we certainly see that acutely with using. We do see when the alcohol exits the system that you do get an amount of rebound anxiety like symptoms, even again after just acute one night use or one afternoon of drinking. So we can see that kind of, and as we get older, our bodies become more sensitive to that. So we can see that a 23-year-old who goes to the bar and has a few drinks maybe doesn't feel the effects of that, doesn't wake up the next morning with a headache or feeling dehydrated or those types of things. But as we get older, that same amount of alcohol is just processed differently by our bodies. And we can actually feel those effects more strongly kind of the day after and the hours afterward.
Thank you.
You're welcome.
We have a comment really from Barb Anderson that's close to home for me. She talks about how enjoying staying home more and not having stage fright, and when she's teaching, and that she's pretty well set up for this. And many of us who are at some level introverts feel like we've been training our whole lives for this, and that this is one of the times where it's actually been life that had been easier for that. And I think that there's a whole range of people responses to this. Certainly my colleagues who are extroverts are feeling it particularly, but I think this is just different for everybody.
And based on, what your profession is, what sort of resources you have, all those things contribute to how we respond to different stressors.
I'm having a little bit of internet trouble, so I'm going to ask this last question. Maybe, have you seen whether or not having COVID-19 affects substance use patients, especially those in your hospital stay? Or
Yeah, so we know that some things that kind of can go along with addiction, being underserved, homelessness, living in shared spaces, like a recovery house or being in detox, can put people at some amount of additional risk of substance use. So we certainly do see that. We also see, we also have seen in the hospitals that when people are hospitalized with a substance use disorder, many of our hospitals are frankly ill-equipped to help those individuals. My hospital that I'm affiliated with, I received a grant to start an inpatient addiction service. So we've definitely seen that people who come in that have COVID-19 and have a substance use disorder certainly benefit from having treatment of both. It also particularly can complicate if somebody is in withdrawal. The description of withdrawal, particularly from opioids, alcohol, and benzodiazepines that we kind of read in the books, is that it's flu-like symptoms. What is COVID? Also flu-like symptoms. So sometimes that picture can be very clouded. We're pretty fortunate that most of our hospitals we have the testing supplies and are able to test patients to kind of ascertain if it is a COVID-19 picture or if it is something else potentially complicating the COVID-19 picture. We've been dealing with this for a long time. Classically, we see in post-operative patients, one of the most common causes of post-operative delirium, particularly in elderly individuals, is actually alcohol withdrawal. So we've seen this, that we see this or this type of complication making other pictures worse with a comorbid substance use disorder, even without COVID as a complicating factor. But that certainly is another place where being in withdrawal could mimic COVID-like symptoms.
great. We have come to the bottom of the hour. I want to give people one last chance at asking a question of Cara. I'm going to thank Mark Brevy and Nikki Lecter for helping us set this up and put it together. And I'm just going to give us a couple more seconds if somebody wants to put a question in the QA. And Cara, I want to thank you so much for sharing your expertise and your experiences with us. Thank you for being a part of the College of Human Medicine, and thanks for joining us today.
Thank you for having me. It's been a pleasure as well.
Great. And I want to thank all of you for joining us this evening. Thank you for everything that you do for the college and for helping us serve the people. I hope you have a great evening. Please wear your mask. Please spatially distance. Please wash your hands and try to stay away from as many people as you can. Take care and be safe. Bye-bye, everybody.
Thank you.
Thank you.